This is our clinical judgment video.
There are plenty of basic concepts when discussing what an electronic health record is and how it relates to nursing. The concepts that we chose to talk about as a group are software, hardware, data elements, and security considerations.
Hardware are the devices you'll use to access the EHR. There are many things a unit should consider when choosing the proper device to implement on their unit. The most common devices you'll see are desktops, laptops, and tablets. Desktops are what you would see being used at the standard nursing station. They're stationary units that reside in one location and can't be moved from room to room. They consist of a processor, a monitor, a keyboard, and a mouse. Some advantages of the desktop are their low cost and available from a wide variety of vendors. Because desktop PCs are standardized, it's relatively easy and inexpensive to find separate parts and repair. They're pretty standard, easy to use for each person. Desktops will run just about any software you need, and any additional devices are pretty low cost. Some disadvantages are they're stationary, so you need to buy a desktop or PC for each room that you want to access the EHR software. They typically take up more space than a laptop or tablet PC. While flat screen monitors and tower units save actual desktop space, the standard desktop computer requires more room than either a laptop or a PC. Laptops are commonly used like on carts that you see like on mobile units. So a basic laptop is a fully functional computer that's small enough to be portable. Some advantages are that it has a smaller footprint and can be easily turned to allow patients to view information on the screen. It's less obstructive than a desktop, and they have a fairly long battery life. Some disadvantages are although laptops are portable, they can be heavy to carry, typically weighing 5 to 8 pounds, and repairs tend to be more expensive because laptops use non-standard or priority parts that you might have to send your laptop off-site for diagnosis repair. Then your other option are PCs or tablets. There are two main types of tablets: a slate tablet, which has no attached keyboard, and a convertible tablet PC, which is basically a laptop that has a screen that can be swiveled around and you can write on it. Some advantages are tablets are portable and lightweight, typically weighing 3 to 4 pounds. It's as powerful as a PC, but doesn't require a keyboard. Instead, you can add information by writing on the screen with a digital pen or stylus. Some disadvantages are that writing with a stylus takes time to get used to, and there's a long learning curve in adapting to a new way of using a computer. So a lot of the older nursing staff would take a little bit to adapt to that type of unit.
The next topic is software. A couple examples that we've used in nursing school are Citrix, Paragon, and Epic. And these are used to store all of the healthcare information for the patients. There are pros and cons to all of them. Some of the pros are organization, so it's easier to navigate through the information, easier to complete tasks since you don't have to spend time handwriting everything, and easier to communicate with healthcare teams. Some of the cons are the expense of the software, need for additional training. So if a nurse isn't good with technology or it's a different type of software, you'll have to spend time and money learning how to use it. And possibility of losing data. There are numerous types of software that hospitals can choose from. It just depends on what they're willing to spend money on and what they think is easiest to navigate through.
Next, we want to talk about the data elements of the electronic health record. In order to appropriately use data elements within the EHR, population-specific questions need to be answered first, and then that will guide the healthcare professionals to what data elements should be addressed next. Information management within the EHR have specific standards that align with evidence-based practice. However, healthcare professionals may want to document information that is more specific than a given coding allows. For example, they may wish to categorize drug allergies to specific ingredients rather than just the chemical class, according to the CDC. A concern with the data elements in the EHR is the lack of outcome data. Electronic health records have data in a variety of domains that are standardized, but because not all the code sets are complete, the use of local enhancements to the code sets prevents full interoperability among the EHR systems, according to the CDC.
Because HIPAA governs the access to and exchange of information between electronic health record participants, a healthcare facility should consider the following when determining whether or not to provide a physician with access to whatever the information that is in the electronic health record. Some of the components are whether or not the physician's relationship with the healthcare facility is through those standards, the nature and extent of the information in the EHR the physician is permitted to access, and whether the information is an individually identifiable form or aggregated, or the purpose for which the physician or the physician's personnel are accessing the information. A recent survey from the AMA Journal of Ethics found that 73% of physicians text other physicians about their work. How to keep the information in these exchanges secure is a major problem. Mobile devices are largely designed for individual use and were not intended for centralized management by an IT department. Computer workstations are rarely lost, but mobile devices can be easily misplaced, damaged, or stolen. Another potential threat is that data can be hacked, manipulated, or destroyed by internal or external users, so security measures and ongoing educational programs must include all users. Some security measures that protect data integrity include firewalls, antivirus software, and intrusion detection software. Regardless of the type of measure used, a full security program must be in place to maintain the integrity of the data, and a system of audit trails must be operational. Providers and organizations must formally designate a security officer to work with a team of health information technology experts who can inventory the system's users and technologies, identify the security weaknesses and threats, assign a risk or likelihood of security concerns in the organization, and address them. The responsibilities for privacy and security can be assigned to a member of the physician office staff or can be outsourced. Organizations can precisely monitor who has had access to a patient information with what we call audit trails. Audit trails track all system activity, generating data and timestamps for entries, detailed listings of what was reviewed, for how long, and by whom, and logs all of the modifications to the EHRs. Administrators can even detail what reports were printed, the number of screenshots taken, or the exact location a computer used to submit a request. Alerts are often set to flag suspicious or unusual activity, such as reviewing information on a patient one is not treating, or attempting to access information one is not authorized to view, and administrators have the ability to pull reports on specific users or user groups to review and chronicle their activity. Software companies are developing programs that automate this process. End users should be mindful that, unlike paper record activity, all EHR activity can be traced based on the login credentials. Audit trails do not prevent unintentional access or disclosure of information, but can be used as a tool to ward off would-be violators.
I think that's all we have about EHR. Thanks for listening.